If you want to walk into your medicine interviews feeling confident because you actually know all of the content, then this is the video for you. In this video, we're going to be covering abortion, which is a key hot topic that you need to be able to understand and talk about as it could come up as part of your interview questions. Hi, I'm Loveleen, a medical student at King's College London, here to help you with your interviews. Now, I completely understand how daunting and difficult interviews were, as I was in your position. But fast forward a couple of months, I went on to achieve all 4 of my offers with interview scores as high as 135 out of 140. And I'm here to help you do the same and achieve your dream of studying medicine. On my channel, I talk about all things relating to medicine, entrepreneurship and mindset. Now, to help you, I've also created loads of different resources. First up is my Aspiring Medics newsletter for completely free resources. On this, I post loads of different tips relating to the journey of getting into medicine, especially around during UCAT season and interview season, and what you can be doing to help you achieve your dream of studying medicine. Additionally, one of the key reasons that I was actually able to get all 4 of my offers was my interview document. This is an over 50-page document in which I've included all of the content that you need to know, ethical pillars, over 100 different types of questions, and also the NHS hot topics and research. If you're interested in this, make sure to check it out using the link below. Additionally, if you want more personalized support with helping you get your 4 out of 4 offers and studying medicine at your dream uni, then check out my interview course. Again, as part of this interview course, you get personalized, tailored learning given to you about all the content, learning how you should actually be structuring your interview responses, what your interviewers want from you when you're doing a med school interview, and the art of speaking and presentation, because this is so important in helping you secure your offers and get into medicine. So taking a look at what abortion actually is. Abortion is the ending of a pregnancy so that it doesn't result in the birth of a child, and this is often considered to be a medical procedure. There are 2 different ways through which abortion can be conducted. The first is surgical abortion, and this is when a surgical operation or procedure is conducted to remove the fetus from the womb. The second method is medical abortion, and this is when 2 different types of medication or drugs are given in order to remove the pregnancy. Within medical abortion, there are 2 different pills that are used in order to terminate the pregnancy. Now, the second pill, since 2018, the government legalized that it can actually be taken at home. Now, there are many different ethical debates surrounding this, as some people believe that this is beneficial because it reduces the risk of miscarriage during the journey between a healthcare clinic and home, as this was something that often women experience and it could feel quite traumatic. However, others believe that this may not be a good idea. The reason for that is because this pill could actually be given at home and there is risk of abuse or forcing the pill onto a patient who may not actually want to take it. In terms of laws relating to abortion in the UK, the Abortion Act of 1967 has multiple different points included in it. Now, first, it's important to highlight that abortion is legal in the UK, and under the Abortions Act, something called the Human Fertilisation and Embryology Act states that for abortion to be legal, it must be done at 24 weeks or under. However, there are some exceptions that can be made. For example, if the mother is at severe risk of, for example, miscarrying, of having a physical or a mental illness due to going through with this pregnancy, in these cases, an abortion can be legal. Abortion sparks many debates. We also had the legal debate, which is the idea of when does a fetus actually become living. Some people believe that a fetus is living from the point of conception, which means that at any point during that time, up until the child is born, if you conduct abortion, that it's considered to be murder. However, others believe that it's not until the child is born that is when you consider it to be living, essentially. So due to this debate, this sparks a significant legal discussion as to at what point would it be okay for an abortion to be conducted and at what point would it be murder. Some arguments that you need to consider by people who oppose abortion and think it should be illegal include the fact that people may believe that life begins from the point of conception, which means that carrying out abortion at any point from then onwards is considered to be murder. Additionally, some people believe that once the child is born, if there is not a suitable environment for that child to be raised, adoption is always another option. Additionally, it's also suggested that the process of abortion could actually be a psychological stressor for the person going through it. Now let's take a look at the arguments which are held by people who are in support of abortion. The first is that sometimes the way a woman gets pregnant may have been very psychologically distressing, for example by rapes or by other ways, and this could mean that actually for the woman to go through with the birth could be more traumatic and cause more psychological stress to both the woman and the child, especially if the birth would occur in an unsafe environment. Another key point to raise is that if abortion was not legal, something called backstreet abortions could occur. This is when they're carried out either illegally or in secrecy, and this is because women may have no other option to turn to because abortion would be illegal. By keeping it legal, it makes sure that the medical procedure is actually conducted in a safe manner, there's less risk of infections and more likely to go in a safer manner in comparison to doing it illegally, where there's a much greater risk of things going wrong and for infections and other conditions to develop. In some cases, an abortion also may be necessary, for example, to make sure that the woman who is pregnant actually survives. Sometimes there can be conditions which the woman can develop which actually make her at risk of not surviving the birth. So abortion is one of the topics where there is significant legal and ethical debate, so it's really important that you're able to present both sides of the argument in your medical school interviews so you can talk about it again in that analytical manner and show that in-depth understanding of both sides of the argument. Again, to make sure that you know all of your medicine interview content, check out the rest of my YouTube videos, as I have videos on all of the interview content that you need to know.